Well, thank you, Conrad, for that forecast. And you may have spent your summer wearing your favorite sandals or working in the garden, but these simple things can cause some annoying skin conditions called corns or calluses. Isn't that right, Nurse Christina?
That is
Yeah, thanks for
right.
joining us this morning. Always appreciate you making it in on Tuesday.
Thank you. I know those are two things that we always think of old people, but they really can happen to any of us.
Well, yeah, what is it? When you're out in the garden, I know, working on the farm and stuff, you can get it like right on the top of your hands there. Isn't that right?
Right, and those are calluses. And so calluses form when skin is constantly like rubbed against something. So when you're working with implements, maybe you don't have gloves on, and the skin is constantly being rubbed. That can occur if you're chopping wood, getting ready for winter. If you have a wood fire.
Oh yeah, that happens.
Yeah, that can occur. And then corns are a little bit smaller. They typically tend to go where bone, like where bone would meet. And so typically like shoes can cause that to happen when you're constantly, if they don't fit right, you're constantly getting that rubbing. And corns can be a little bit smaller. They're a little bit softer than a callus. And they tend to kind of have a little dimple in the center of them. Yep, but both of them are caused by your body's way to react and protect itself against friction.
So how does someone know that they're actually developing this skin disease or just calluses in general?
Sure. So first you're going to see them. They'll be obvious because you're going to have that roughened skin on your hand. You might even develop a blister first. And then it's going to be kind of a thick, rough skin area around there. It can be hard, raised, tenderness, sometimes pain. They can be flaky or just look like dry skin. And corns and calluses they just will occur, and you'll see them. And the pain is usually what we can ignore. Little skin things and roughness, but when it starts to cause pain, that's usually when we think, okay, now it's time to
maybe
treat.
Stop that.
Right.
Well,
exactly.
Speaking of calluses and corns, calluses, I'm familiar with those. You're just working hard with your hands. It happens to, I don't know, probably a lot of people.
Yeah.
And but a corn, I just am having trouble visualizing it. Does it literally look like a little kernel of corn?
No.
Like on the skin, or
no,
like a little dimple, or is that?
No,
is it smaller than that?
It looks
maybe?
like a callus. It can almost look like a larger wart too. But they'll be on the, you'll get them, people get them in between their toes. It's usually on your feet that it occurs. And you can get them between your toes or right on the top of a knuckle of your toe or foot that's rubbing. And so, that's kind of, it looks like a callus, but it's just a little smaller and softer.
So what's the difference between like a gym callus, because I go to the gym very frequently and I have those. I never have any pain with it at all, no blisters out of it. So what would be the difference between like getting that or something that you were mentioning?
Sure. So, I mean, you're going to get the blisters. People who play guitar will get them on their fingers. You can get a callus really any type of activity that you're doing workouts. And there's really simple things that you can do to prevent and treat them. You can apply, there's corn pads that you can buy from Shoals. You can get those at Walgreens, Walmart, any place. And, or you can use moleskin for calluses. You can cut it to the size of the callus and put it on there. Wearing proper fitting shoes or gloves will help protect. And you can keep your nails trimmed, the toenails trimmed, because it's tight fitting shoes that often will cause this to occur. And I would think that somebody who is like in construction or military, where we wear boots that can be ill-fitting and you're constantly getting that rubbing when you're moving, that can cause those to occur too. So having shoes that fit properly, you can soak the foot or soak the area of your hand and use a pumice stone to kind of file off the callus or the corn. You just want to be really careful not to rub the skin too low. I would think for hands, I probably wouldn't use a pumice stone. You could use that for your feet, especially with corns. But if you're a diabetic, you want to make sure that you talk with your provider or go to a podiatrist to have those things taken care of, because diabetics often have slow wound healing, so you don't want to do anything that's going to cause an infection or open the area up. And there's also creams and lotions. So for somebody with hands, that would be my best advice. And you want to get a lotion that has salicylic acid or ammonia, lactate, or urea. Those are the best to really soften up those areas. You can get, like I said, the medicated pads, shoe inserts too. And for really severe cases, sometimes surgery is needed.
Oh, wow.
So if you have a corn that stays in place too long or rubs too much, it actually can form an ulcer underneath it.
Ooh,
yeah, so that's where you
Not
really get a lot of the pain.
Yeah,
Right.
so if this isn't, going away on your own remedy in a short amount of time,
Yeah.
please get it checked, because you'd hate for that to happen.
Right, absolutely. So if it's early on, you're young, somebody like you could use lotion on your hands,
Okay.
maybe at night, put that on. But if you're older and you have other health issues like peripheral vascular disease or diabetes or any kind of cardiovascular disease, you want to.
No, that's always good. You want to get in there before it turns into a real problem.
Right.
Absolutely.
Catch
Get it caught
it
early. Yep.
Yeah.
There you go, Connor.
Yes.
Well, thanks so much for coming in this morning, talking
Yes,
about
thank
us. Love talking corn with you.
Right, that's
calluses
right.
And calluses. It's a good farming show we got here.
That's right.
But thanks again. Always a pleasure, Nurse Christina.
Thank you so much.
All right. And coming up, we have What's Trending, including